Dr. Yashika, you can start. We are live.
So, hello everyone, and welcome to today's webinar by Team Homeopathy 360. A very warm afternoon to our esteemed guests and colleagues who are with us today. Hope you all are safe in this lockdown period. For all of you joining us and already joined, I, Dr. Yashika Arora, heartily welcome you all. I'll be the moderator of today's session for all of you. Before we begin, I would like to introduce you to the BJN's online education platform, that is Homeopathy 360. It is one of the most updated portals for online publication of all kinds of course material for students, latest news, events, career opportunities, articles from various practitioners all over the world, journals like Homeopathic Heritage, Homeobuzz, presentations, videos by different stalwarts. We have all sections for all these things. This is one of the most updated portal. And we have always tried to connect homeopaths worldwide and broadcast their talent, aiming advancement of homeopathy as an evidence-based science. It has been an exceptional education hub for each generation of homeopaths, whether a clinician or a researcher or a practitioner. We try to organize every single information related to homeopathy, make it universally accessible, making sure that we are the best at what we do. On behalf of our whole team, I would like to invite all the esteemed homeopaths present with us right now to contribute your knowledge and experience in your core area of expertise, and visit our website www.homeopathy360.com for the same. So before we begin, let me acquaint you with the members of our team who will be working behind the scenes while we conduct this webinar. Dr. Rajesh, I welcome you. He'll be with us at the backend system to ensure that the webinar runs smooth. And just to update you all, you have a chat box on the upper right corner of your screen. You can see on your screen you have a chat box wherein you can type your questions and send to us by pressing the button next to the box. We'll also be running a question answer session at the end of the webinar where you can clarify the queries with the presenter. And you can also raise your hand if you want to share your question or you want to talk to discuss with the speaker in the end of the webinar. So now, without wasting any more time, I would like to introduce you to the dignified speaker of today's webinar. We have Dr. Heena Rawal. She is the Principal and Medical Superintendent of Ahemdabad Homoeopathic Medical College, Parul University, Ahemdabad. And her topic of discussion is demonstration of case taking, eliciting mental and subjective symptoms. Also, she'll be sharing with us few of the tips for case taking in the clinic, especially for the case of individualization. So I welcome you, ma'am. We have Professor Dr. Heena Rawal with us, and now I would like to request you, ma'am, to take up from here. Thank you.
Thank you very much, Yashika. It's and a very good afternoon to all the viewers and the students out there. So I'm thankful to B. Jain for inviting me today to this series of webinar. And it's a great opportunity to address all of you from this platform. Now, without wasting any time, I would like to start with my presentation. One thing I would like to make it clear that my presentation, I have not included cases because see, the presentation is related with how to find out the mental symptoms, and it varies from case to case. So it is something which is not uniform. So today, as it is a practice that everyone has a case to present, so I'm not going to present cases because I'm going to stick to the principles of Organon. And according to the principles of Organon, I'll be showing that how Dr. Hahnemann himself has taught us how to elicit the mental symptoms. So let us begin with my presentation. This is the topic, as Yashika has already said, that it is the eliciting of mental and subjective symptoms, which are very important for your individualization. And so I'll start with that. Next. Next. Okay, so coming back to the presentation, that I have begun with what Dr. Hahnemann had started with. That on the very first page of Organon, in the very first edition which he published in the year 1810, he had written that the truth we mortals need to us blessed to make and keep, the always slightly covered over but did not bury deep. Now, see, this was the poem, as all of you must be knowing. It was a stanza of the poem from a famous German poet, Gellert, which Hahnemann had published on the very first page of first edition of Organon. Now, this is very much implicable to our case taking also, because here he has written that the truth means that what is necessary, that what is needed for us mortals like human beings who are going to die, who has taken birth and are going to die. And these things which are necessary, which are a blessing for us, which can maintain and sustain our life, those things, the all wise, that is the one who knows everything, that is the Almighty God, has just kept within our reach. It is not buried deep inside, it is just slightly covered. We have to make a little efforts and we can reach to it. So here it is very nicely what Hahnemann had written was for he had written for the law of similia, that the law of similia was a nature's law. It was very much present in the nature. A little efforts which were put by Dr. Hahnemann with the experiment of cinchona bark and with for 6 years of experimentation with 50 other drugs, he was able to formulate similia similibus curantur, which was a blessing and which was helpful for the sick mankind. Now, this Hahnemann was so humble that he was giving whatever he had done for homeopathy, he was giving all credit to the Almighty, to the All Wise. But later on, as you know, that he was severely criticized after the publication of the first edition of Organon, and so he had replaced this stanza with the word audiu sapere. But why I have taken this stanza, this is the thinking of Dr. Hahnemann. The same thing happens in case taking, that we feel that to bring out the mental symptoms from the patient is very difficult. Or sometimes I have seen people saying that it is impossible because the patients are not truthful. They'll not tell you the correct things, what they mentally feel. So it is almost impossible. But see, always the challenges which we face should make us better and not bitter. Same, just as Hahnemann had written this stanza, the mental symptoms which are required, which are very important for individualization, are just within our reach. We have to probe a little more, we have to put a little more efforts, and we will be able to reach to these mental symptoms. And that is why we follow Hahnemann right from the first page of the first edition of Organon, that we put a little efforts more so that we can reach to the mental symptoms which are very important. Now, this is the outline of my today's presentation, that I'm going to tell about the importance why the mental and the subjective symptoms are the symptoms which are felt by the subject, the feelings of the patient. Then why the homeopaths, what are the requisites qualifications or the requisites qualities of a homeopath when he is going to do the case taking for the mental symptoms? What is required from a homeopath, that we are going to discuss. And finally, how do we find out the mental and the subjective symptoms from your patient? So these are the things which we are going to discuss today. Now, as I told you that I've taken the stanza from the first edition, in the same way, I've taken the title of the book Organon, the Bible of Homeopathy, written by Hahnemann. And that is, the title itself says Organon of Rational Art of Healing. See, this is very important. As you know, again, the word rational means something which is lawful. And again, Dr. Hahnemann was criticized for this. And so he had to remove the word rational later on, because people had a stupid argument that if homeopathy is rational, that means the other pathies are irrational. And just to avoid the controversies, Hahnemann had removed this word, because controversy had followed Dr. Hahnemann right throughout his life. Even after his death, his body had to again reburied, so the controversies continued. But here, see, in the title of Organon itself, the word art is used. He did not say it is the science of healing, or he did not say it is a theory of healing. He did not say it's the principle of healing. He just said that it's the art of healing. See, when you are using the word art, means it is something to be performed. Arts cannot be just talked about or cannot be just written, they are to be performed. So when he is using the word art itself in the title of Organon, every new patient, your case taking is an art. It is just not theory. Nobody can write a page or books full of how to do case taking and you can learn from that and go perform brilliantly. It's not possible. You learn it how to perform it from each and every patient which you get in your clinic every day. You keep on improvising. For different patients, your art will keep on changing also. So this is an important thing, that our pathy, like other pathies, is just not a science, just not principle, just not theory, that what is applicable to one is applicable to all. For each individual patient, you have to change your techniques, and especially to get out the mental symptoms from your patient, this art is to be performed. So all the students out there, just remember that this is an art which is to be learned, how to do the case taking or the case perceiving. Now, this is an important thing, that mental and subjective symptoms reflect the most individualistic phenomenon of a patient, and that is why it becomes the most important to elicit. Now, see, this shows that how important are the mental symptoms. They are the most individualistic. And this is, see, why it is most individualizing. Because your mental symptoms or your subjective symptoms is a disposition of a person. Each person has its own disposition. Some may be very anxious, some may be restless, some may be very calm, some may be lachrymose, everything makes them cry. So, see, there is a disposition which is there with each and every person, which comes to the person right from the birth, which can be altered, but more or less remains with the person till his death. And this is an individualizing characteristic feature of a person, that he is different from other people. They may be staying in the same house, same, born to the same parents, but still each person has got his own disposition. And in mental symptoms, we try to find out, we try to learn about this disposition. As I said, I've used the word mental and subjective symptoms. I told you subjective symptoms are the symptoms which are felt by the subject. A person feels it. Usually we say that the subjective symptoms begin with an I feel chilly, I feel tired, I feel hot. Now, see, it is beginning with an I. It is something which is happening to the person as a whole. Even if it is a minor physical symptom, it is affecting the mental plane of the person, the mental state of the person, and that is expressed from the mental plane only. I have got a minor cut on my finger, which pains a lot. So see, it's not that only it is affecting the physic of the person. It is affecting the psyche of the person also. So why they are individual? Because it is something which affects the person as a whole. The center is disturbed, and because the center is disturbed, this disturbance is seen in the periphery. And therefore, the center which is unique, the center which is individualizing, the center has to be looked after. And therefore, we say that the mental and the subjective symptoms are the most, the particular symptoms or the physical symptoms may be the same. But mental affection can be different. Say, for example, if a person is suffering, if there is in a hostel, there is one girl who is suffering from fever. She may just calmly lie down. She's not doing, she may take her own medicine and she's lying down. Another girl in the same room, if she has got fever, then she will scream, she'll shout, she wants to go back home. And the whole floor of the hostel knows that somebody is sick in this floor. So see, the symptom may be the same, but the mental attributes or the subjective feeling of person to person differs. And this is the reason that if you want to individualize your patient, if you want to find out a simillimum, if you want the law of similia, that is similia similibus curantur, to work, it is very important that you individualize your patient. Without individualization, it's not possible. Then special importance to mental symptom was given on the theoretical reasoning that disease primarily originates in the level of vital force, and mental symptoms are the real language of the deranged vital force. Taking you back to the chapters of vital force which you have already studied, or if you go back to aphorism 72, where Dr. Hahnemann has described disease per se, that for an allopath, the pus cells in the urine, so he is suffering from urinary tract infection. So a laboratory finding where there are pus cells in the urine, then it is a urinary tract infection. Now we say that the disease had started way back. We believe in the concept that there is a central principle, a central life principle which is governing our material body. And this central life principle is the one which is getting deranged. And as we have already studied the dynamic action, the miasms, the dynamic mobific actions acting upon the vital force and thereby deranging the vital force without any material exchange on a dynamic plane. And that is our philosophy of immaterialism. Now, according to that concept also, if you try to understand that when the vital force is exposed too much to the noxious agents, or when the latent sora is aggravated, then the vital force deranges. And this derangement of the vital force in the very beginning, you can feel in the form of the self-preservative property of the vital force is lost. Self-preservation. It is a never-resting preservative force. That is what Dr. Hahnemann has said. From your birth till your death, it is trying to preserve you from all the mobific influences to which you are exposed day in and day out. We as human beings, we are exposed constantly to the noxious agents. Constantly. At present also, if we see that COVID-19, okay, so many people are affected. But if you just compare to the people who are not affected, there are many more people who are not affected by COVID-19 in comparison to the people who are affected. So the exposure to the noxious agent might be there. We have seen cases also where in a house 1 or 2% are affected and others are not affected. So the exposure to the noxious agent is there. WHO says that every Indian is exposed to the tubercular bacillus. But in India, we know that how many of us suffer from tuberculosis. So the noxious influences are there, but unless and until it does not derange the vital force, we don't suffer. and that is the preservative property of the vital force. Now, first thing for us, the first thing is the preservative property of the vital force is disturbed. When that property of the vital force is disturbed, then we suffer from disturbances in the sensation. When we are healthy, we have got the sense of ease, the sense of comfort, which is replaced by the sense of disease. We feel discomfort. So first is the sense of well-being, which is lost. Then if the disease is not controlled or the medicinal help is not given, the disease progresses and then the functions are affected. So there is a disturbance in the functions. At that time, pathology may come, may not come. Further, if the disease progresses, then only the pathology occurs, that is the structural changes takes place. And that is the time where you can do a lab diagnosis that, okay, as Kent has written in his philosophy, that you can pinpoint that, yeah, this is, you can see the tumor which is to be incised. Or if you open the abdomen, you know that the kidney is diseased. So, or you see in the urine, the albumin is present. This is what Kent has written. So this is the time that when you will say that, okay, this is the disease, but this was at the third or fourth stage. Before that, the change in the sensation started, and that was the subjective symptoms have already started. The disposition is changing. The personality of the person is changing. The person who said that I'm feeling very healthy, I want to go to work, I want to meet people, I want to talk. That same person says that nowadays I don't like to go to work early in the morning. I don't like to wake up. I don't feel hungry as I used to feel. Or few mouthfuls and I'm satisfied. I can't eat more. So for us, the totality of symptoms can be made at that stage. And that was the beginning of the disease. The end results were pathological changes. So this is the disease per se which is explained. So if you go according to the concept of the vital force also, the mental symptoms are the ones which are the real originators, or they are the ones which are the language of the deranged vital force. We say that the totality of symptoms is the external manifestation of the internally deranged vital force. So it's not that the symptoms which are obvious, which are seen, the pathological symptoms which is going to help you in forming the totality, but way before, the mental symptoms and the subjective symptoms are also going to help to form the totality. Now, as you know that Kent had worked extensively, Dr. Kent had worked extensively on the mind rubrics in his repertoire, and his analysis and evaluation of symptoms to form the totality of symptom is also on the will and affection. He says all symptoms of will and affections, including desires and aversions, are the most important as they relate to the innermost of the man. See, this one person's desires may be other person's aversions. One person's all affections, you take any affections, it can be grief, sorrow, loss, injustice, happiness, joyfulness, love, whatever, all affections, all will, everything are individualizing. Because the way you feel the joy, the intensity of the joy which you feel, the expressions of joy, one person may express in a different way, another person may be expressing it a different way. The joy may be similar to 5 people in the family, but each one, the intensity by which they feel it is individualizing. And again, not only that, their expressions are also individualizing. So these are the important factors, and therefore Dr. Kent also gave so much of importance. And he said that of less value are those relating to the intellect, while those of memory are to be ranked lowest, giving paramount importance to patients' feelings, precipitating factors, aggravating factors, and ameliorating factors. If a homeopathic physician prescribes on these symptoms, improvement will be sure and miraculous. See, he is using that improvement will be sure if you are prescribing on these symptoms. one person's aversion can be another person's desire, and therefore they are unique. They are the most individualizing. That we say that we always take these symptoms, we take the aversions and likes and dislikes. Why? Because they are the factors which will show you the person's personality, or they'll show you that how to the same factor each person is reacting in a different way. So this is in support of the importance of mental symptoms by Dr. Kent also. Then next we say that homeopathy aims at reintegration of the total self with a reduction of unhealthy psychological regression, blockages and isolation. Now see, this is also important. By why? Because we don't just treat the fever, or say the swollen toe, or the gout which is coming to different joints again and again. It is the person, the holistic approach of homeopathy. There may be certain things which are not allowing the man to remain at peace or to remain completely healthy. And therefore, we are trying to reduce the unhealthy psychological regressions. Now, this reminds me of a patient. I had this patient, say, about 7, 8 years back. A widow. She was a widow of a middle-aged woman, 55 years, and a very calm, noble person, very pious, always praying and going to temples. And she had lost her husband in a sudden cardiac arrest. So very much disturbed by that. Now she was coming for her menopausal complaints, and to certain extent the medicines were helping her, and the menopausal complaints were getting reduced, but she kept back coming again and again with some other sets of complaints also. Now then, after few visits, I had a bit of rapport with that patient. And then one day she said, she always used to come that morning, I have a very bad headache. Every morning I have a I asked her that whether you sleep properly. She used to say, okay, sometimes I sleep properly, sometimes I'm not sleeping properly. So every now and then, something related to lack of sleep or something related to constipation, something came up. Then one day she told that, ma'am, I want to tell you something, and I'm very ashamed of it, but I feel that I should tell you because you keep on asking me so many questions, and since so many days I'm not telling you this. But I stay in a locality, and there are some young boys staying around my house, and usually they come and sit in the front yard of my house, and in the evening they sit there, they chat over there, and sometimes they play cricket over there, and I watch them playing, and they are of my son's age, almost like my children. But it happens that I get lascivious dreams of those boys, and then I feel so guilty about it. I wake up and I feel so guilty. I keep on increasing my puja, the spiritual rites which I'm doing. I keep on increasing because I feel that I've committed a sin. That the boys who are of the age of my children, I'm getting such ideas and such dreams about it, and so I'm committing a sin. And I don't feel good afterwards. I feel dirty, and then I go to many temples and I try to wash off my scenes in that way. Now see, this is the blockage which is coming to that lady again and again. She was trying hard, maybe because of the sexual desires which was suppressed, or maybe because some psychology which she is undergoing, and she is facing this. Now see, this became a very important part of the totality of symptoms, and till then I was not covering this as a totality, in the totality of symptoms. Later on I covered this, and I was able to, and with that, with the help of a bit of psychotherapy. See, we homeopaths, involuntarily we become psychotherapist also, because we take such a detailed history. So many a times the patients come out with such things, such emotional blockages or emotional guilts which are there in their mind, and we help them to come out of those guilts. So sometimes these are the things which are important, and these are this is the beauty of the mental symptoms. But see, they don't come out, such mental symptoms don't come out in the first or the second visit. Later on, I have included that how the physicians have to behave so that the patient can come out with these mental symptoms. I've talked about isolation. I had a person about 65, 70 years old, and he lost his wife. He was staying with the son and daughter-in-law. And he had so many complaints. Every day he used to come to our college OPD with varieties of complaints. And every time he was taking medicine, he was feeling better. Again, next day he was coming. So practically every day he was coming to the OPDs. And then later on, it was found out that he was feeling isolated. He was feeling alone in the house. And for that, then we occupied him in our hospital work, and majority of his complaints disappeared. So see, certain things are that they might seem to be very negligible or very not very important, because I'm talking about this man isolation. He was literally having the symptoms. He was sometimes having eruptions, then it was severe constipation. He was not passing his bowels for 4-5 days, and as soon as he became active, then all the complaints gradually started disappearing. So this is the importance of the mental symptoms. The homeopathic prescription and general approach towards the person helps to lessen the thoughts of painful hurts and memories. These are the, see, as I told you, these painful hurts or painful memories. Again, there was a patient, the painful memories I would talk about. She was a Christian lady, and she was working as a receptionist in one of the big hospital, and she was very smart, nicely dressed, very expensive shoes, and always wearing makeup. And then suddenly she went into depression. I have saw her after many years, and I saw that she was all shabby. She was like looking like she has grown old by say around 25-30 years. And then she also had menstrual disorders and complaints, and she was, the history was taken. This was the case when I was doing my MD, and in my dissertation I had included this case. And then after 4-5 visits, she was not feeling better, not feeling better. Then I asked one of our psychotherapist. I knew a psychotherapist, and I asked that psychotherapist, and I said that once at least you talk to this lady, that why no matter whatever I'm trying to give, her complaints are not coming. Like I was treating her for 6-7 months, but the complaints were not getting completely cured. And then it was found out that she was once riding a scooter and taking her younger brother to school, and that municipal bus came, the big buses which are in the cities, and they had an accident, and the younger brother died in that accident. And that guilt was so big in her mind, that guilt, that painful memories, and because of that she had gone into such a severe depression that she was not looking up, she was not bathing for days together. So that was not allowing her to get better. So see, these are the things which you are supposed, as I told you, the things are not buried deep, they are within your reach. You probe, you try to create the rapport with the patient, and with take help. If it is not possible with you, you can take help of some psychotherapist. And these are the things which are going to change your prescription, and they'll become more beneficial for your patient. Now, see, as you know, aphorism 3, all of you have studied that this is the requisite qualifications of a physician. The physician has to perceive what is to be cured in a disease. Now, this is, I always tell the students that this is the most important aphorism in Organon. This is the beginning of Organon. The first two aphorisms, that is the mission and ideal cure, are more about the morality of a homeopath. But the beginning, the teaching of homeopathy starts from this aphorism. The physician has to perceive. Now see, there is a difference. First we just see the patient. Just seeing the patient and observing the patient is different. To get the mental symptoms, this is the discipline which you should create. See, I may go to an art gallery, I may see the paintings, and after a while if somebody is asking me that what was that painting about, I don't know anything about it. But say when I've observed the painting, then I'm able to say that, okay, it was a sunset, or it was a village, or it was a temple, and there were children playing outside the temple. But that is when I've observed. So when you see with a purpose, it becomes observation. And this observation, when you interpret it rightly, you perceive it with all your senses, with your sound senses, all senses of hearing to your patient, of looking to your patient, of understanding what the patient is talking to you, then it becomes your perception. And this perception will get converted into a conception. Conception means a theory, a story will be formed in your mind that this is what the patient is trying to tell you. So it's very important, the third aphorism, that if you want to judiciously treat your patient, judiciously and rationally, rationally means without cheating, according to the laws, and giving full justice to your patient, and you want to become the true practitioner of the healing art. See, it's not just curing. Hahnemann has used, and the way it is translated, Organon, these are the wonderful words. We just don't cure patients, we heal patients. See, itself shows that curing may be removing the symptoms, but healing means you remove the symptoms from the root for permanent restoration. And you heal the patient mentally, you heal the patient physically, emotionally, spiritually, on all aspects of the patient. The patient should feel better, he should feel at ease, he should feel that comfort. And therefore, in the third aphorism itself, he has written that the person who has got the requisite knowledges, he has described all the knowledges, the knowledge of disease, the knowledge of medicine, application of the knowledge of medicine to the disease. So all knowledges he has explained, how to select the simillimum, how to decide the potency, when to repeat the dose. And all this, he has said that that can make you a physician of the real healing art. You can heal your patients. How you can heal? You can heal them judiciously and rationally. That is without cheating, with full justification, seeing to it that the person is enjoying the health which he was enjoying before he became sick. That is restoration, permanent restoration of the health, which he has talked about in the first and the second aphorism. So this is what is needed. And he has used another thing, perceive in every individual case. So you have to perceive every patient which comes to you. What you have perceived in one patient will be applicable to all. No, it's not like that. You have to perceive every patient which comes to you. So each patient is individual. Each patient, as I told you, your art of case taking is to be performed. What you have done for one will be applicable to everyone. That is not possible. Now see this aphorism, that is aphorism 6 and 83, that A which is written is not necessary, but actually it is aphorism 6. Hahnemann has written about the unprejudiced observer. He has again mentioned it in 83 aphorism, that is where he has started the tips for case taking. Now why I'm telling you this is the, I always tell the students also that this is the most difficult aphorism to be practiced in homeopathy. You can treat a miasmatic disease by giving an by following Organon, by giving anti-miasmatic disease medicines, or you can follow Organon and decide the posology also. But this is the most difficult to be practiced, because to become unprejudiced, to become free of all bias, all preconceived ideas is very difficult. It is a thing of discipline. You have to condition yourself, then and then you can become unprejudiced. Otherwise, to become unprejudiced is very difficult. We have been trained by some of our seniors, and so we adopt their style. Some say that, okay, the constitutional medicines are the best, and so we, for every patient, we try to find out the constitutional. Some say the anti-miasmatic medicines are a must, so we try to find out anti-miasmatic for all. Some say the concomitants are to be considered. Some say the aversions and likes are to be considered. See, there is then now, as you know, there are different schools of homeopathy, and each school is teaching different ways of how to individualize the patient. And therefore, unknowingly also you become biased, you become prejudiced, and you perform non-observation or mal-observation. Either you wrongly observe your patient, or you don't observe at all. So it can be non-observation and mal-observation. But to become unprejudiced without any preconceived ideas in your mind is very difficult. See, when you practice, you will understand, or even you must have seen, as soon as the patient is walking in your clinic, the medicines are popping in your mind one after another. The patient tells you one symptom, you feel, okay, this is the medicine. Second symptom, no, 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 not this, this is the medicine. So I always say that this is the most difficult, that to become unprejudiced, it is very difficult to become free of all bias, but this is necessary. We have to discipline ourselves. Don't get your ideas fixed that it should be only constitutional, it should be only superficially acting, or a bowel remedy. Be free of all biases, and as per the needs and requirements of your patients, you decide that what is to be given. So this is very important. Then how do you investigate your patient? That is, that you try to see all the facts, you try to understand. See, in chronic disease case taking also, this is aphorism 98. In the case taking of chronic disease, Hahnemann has written that you should understand the human nature completely. If you don't understand the human nature, then it is very difficult to find out the simillimum. The understanding of the human nature is very important. For that, he has also further said that, that is in aphorism 213 also, he has said that we shall not be able to cure homeopathically if we do not, in every case of disease, even if it may be acute, observe along with the other symptoms those symptoms which are related to the change in nature or the change in disposition. See, this is very important, that when you are going to find out the mental symptoms, the question which comes, or the questions must be formulated, that if the patient says that nowadays I am become very ill-tempered, then then you ask, you compare that how were you before 6 months, and how aggressive you have become. Now I shout, I hit back. See, whatever it may be. So the change in personality is very important, that you try to inquire in the change in personality, and you keep patience, you listen to the patient carefully. I always tell students that if you speak more and the patient is speaking less, then your case taking is going totally wrong, because you are putting the answers in the mouth of your patient. So let the patient speak, and you have to listen. You don't have to speak more and ask questions. Now, see, this is many a times it will happen, not all patients, but the patients will not behave properly. They'll be dishonest, they'll tell you something wrong. So you can just read that how the patients can be. They can be unpunctual, they can be ungrateful, unreasonable. So to get the history from your patient is always not easy. They may not speak properly, or they will give you very vague answers. So it's not possible. But you have to remain patient. You have to not forget your duties, your responsibilities. So whatever may be the behavior of the patient, because see, he is suffering, he is in distress, he is anxious about his illness, and so the behavior might change, and this change in his behavior will be helpful to you to find out the disposition of your patient. So just ignore the rudeness of your patient, but you remain calm, and you just stick to your target, that you want to find out the simillimum. So whatever the patient is behaving, you just quietly, these are the requisites that to elicit the mental symptoms. The physician, as I said previously, you remain polite, you remain well-mannered, have sense of humor, having a habit to greet pleasantly. So when you treat your patient here in further aphorisms also, Dr. Hahnemann has written aphorism 227, 228, that many a times the behavior of the physician is the physical remedy. The way you talk to your patient, the way you behave with your patient, you show that he is full of senses, he can be given respect to. So your approach will create that rapport by which the mental symptoms can come out. See, that is what I told you, that on the first visit, the patients were not telling many things. But later on, gradually the patient started saying about the dreams, or started telling about the hurt or the memory which was there for so many years and which had not come out, and for which he was ashamed or he was not able to tell certain things. But this will come out gradually, but it depends upon you, the way you behave with your patient. The patient should have full trust, full confidence in you, that with the most private things which are happening to him or her, which he has not disclosed to anyone, those things will come out with the patient. Now, see, this can be by your words, your action, your behavior, your speech. These are the different things by which you can bring out the hidden behaviors of the patient, or the hidden mental things which the patient is facing, by your compassion. See, if the patient is suffering, or there is a mental illness, or the patient feels that there is nothing, nobody is ready to listen to him, your gestures, you show compassion, you listen to him. The patient is talking and you are also talking on the mobile phone, then none of the mental symptoms are going to come out. It is never going to come out. So you have to be very confident. You should be very attentive to your patient, and you see to it that whatever the patient is telling you, you are listening to the patient, and you are not just jumping to conclusions. You are trying to become as attentive to your patient as possible. Now, see, this is this slide I like the most of my presentation. This is attentive listening. I've taken a photograph of a donkey, but when see the animals, they try to hear from the air which is blowing, the wind which is blowing. And so they have to be very attentive. And this is a very nice line written by Dr. Dhavle, that homeopath must be alert and attentive. Homeopathy refuses to reveal its secret to the casual inquirer. It is more or less related to mongrel sect, that if you are just thinking that the similimum will come flying to you like roasted pigeons and they'll fall in your plates, that is what Hahnemann has written. And then you say that, okay, I was not able to select the similimum, you don't take that blame, but you say that the pathy is not working, and you switch to another pathy. So the selection of similimums, or homeopathy refuses to reveal its secret to the casual. If you are very casual in your approach, the subjective and the mental symptoms are not going to come to you, and you will become one of the mongrel sect, the crossbreed dog which Hahnemann has described, that it is not easy to come to the similimum. You have to work for it, and then only the similimum will come up. So this is what I told you, that the physician has to be sympathetic. We should aim to cure sometimes, relieve often. See, sometimes it may happen that the disease is not curable. It is not in your scope. It is a limitation. But how you talk to your patient, just by talking to the patient, that is a form of psychotherapy, which Hahnemann has very beautifully described in aphorism 227, 228, that the way you talk to your patient, the anxiety can be relieved. This is, see, it is the friendly talking, or sensible advice to your patient, showing respect to your patient. This is an auxiliary mental regime which is described in aphorism 28. It can become an auxiliary mental regime, that not only it will help you to find out the mental symptoms, but it will help you to relieve the patient also. Now, see, this is again a very important thing. when the patient is talking, what I said, that during case taking, if you are talking more and the patient is talking less, then you are not going to get the important symptoms. Listen very carefully to your patient. He is describing his remedy. A very important sentence, that the patient itself is reading the materia medica in front of you. You have to read between the lines. You have to listen to the patient. And if you listen to the patient very, very carefully, then the patient himself will describe the materia medica will come. Now, patient is unburdening his troubles. This is nothing but ventilation as known in psychology. What I told you previously also, that this is a form of psychotherapy which you are giving. See, here again, I think the time is running out, but at least one case I'll tell you, that I had a family of patients. The whole family was coming to me, and the family had a girl, a young girl, and she also was coming for medicines. Many a times the mother came and complained that she doesn't want to get married, and now she is of a marriageable age. She doesn't want to get married, and the whole family was worried about it. So she, many a times the mother kept on, and because of that the mother was having some complaints because the girl was not getting ready to marry. Now, one day it happened that the girl came alone. The mother went somewhere, she dropped the girl and she went somewhere. So I just see, we don't, in case taking, it is written that we don't ask direct questions. But here I asked the girl that why you don't want to get married. And she says that I don't like males. I don't like males. I don't like the aversion to the opposite sex. So I asked a direct question, that had anybody abused you? And she stared at my face, and then she suddenly started crying. And she said that, who said? Who told you? So I said, but just tell me who did this to you. And then she told that the grandfather who was staying with them. Now see, this is, and then she cried a lot, cried a lot. Now that girl is married also, but that as a child, the parents used to go out for parties and she was left alone with the grandfather. And whenever sometimes she said that, take me along with you, the parents used to say that, of course, Dadaji is there, you stay with Dadaji. And this was the thing which was troubling her. It was, see, if I don't go into the detail, then my case taking will be aversion to the opposite sex. But it was not aversion to the opposite sex, it was ailments from abuse. So see, this is how it changes. And for that, you have to train yourself. You have to train that the patient may come out with such things with you. So this is, now see, this may also occur that you are misguided, which is explained in aphorism 96 and 97, that many of the patients are, they exaggerate their complaints. Some of them are hypochondriacs, some of them are impatient with their sicknesses, and therefore they are exaggerating their complaints. And they'll give the complaints, it is written in Organon, they'll give the complaints in vivid colors. And so it becomes very difficult for you that what is the, it becomes a maze of symptoms. And some out of false modesty, or there is something which is very, very private, or something because they are indolent, or they are very shy, or they are not intellectual capable, and therefore they will not come out. The difficulty which you face in taking the mental symptoms, that you have to decide by your experience, by your knowledge, by your wisdom, that whether this is the exaggeration of the symptoms, or whether it is the patient is suffering but he doesn't like to show that he is suffering. So this again requires the skill of the physician, that how you try to find out. And for that, what I said, that you go to the thoroughness, you go to the depth, you ask questions, you talk with the patient as much as possible, allow the patient to talk, and you listen patiently. Sometimes, as it is written in aphorism 93, that some of the questions require privacy. The patient, either you have to talk to the patient, or sometimes the attendant of the patient, or a friend of a patient, where you suspect that there is something which the patient is not telling you. It may be, say, a past history of debauchery, or a past history of alcoholism, or a love failure, or some family stigma, somebody has murdered someone in the family, so there is a stigma in the family, or some extramarital affairs, something which is like it is like a burden on the patient's mind, but the patient is not able to tell. Like, say if the husband and wife has come to you and there is a burden of extramarital affair, then naturally in front of the spouse they are not going to come out with that. So you have to understand these conditions, talk privately to the patient, or talk to the friend of the patient or an attendant, and try to find out that there may be certain reasons that because of that the patient is not able to tell you. You have to ask your attendants or your assistants who are sitting with you, also ask them to go out and then talk to the patient. Now, other things you can find out mental diseases and chronic disease. Hahnemann has written that from his day-to-day routine, his social and domestic relationship, his relationship at the workplace, how he is behaving at the workplace, what is his there is a constant stress going on with the boss or with a subordinate, or there is a very harsh rivalry with his colleagues. So these are the things which will affect his psyche. So, or you ask about the worst situation which he has faced in his life. Say in an ignatia patient, you ask something about the grief or the loss which the patient has felt. Or even sometimes the hobbies of the patient will tell you about his psyche, about his mental status, the fears and phobias. Say a young child is saying that I'm afraid of going in a dark room. Okay, it's fine. But a man of 40 is saying that I'm afraid of going in a dark room, and then he is ashamed of it. He doesn't like to tell this in public, or he doesn't like the family member to tell this or discuss this in public. But this becomes a very peculiar, queer, rare, strange symptom for us, that there is a fear of going in darkness. So dreams, as I told you, the lascivious manias which are coming in the dreams, or any other dreams. So if it is a child, you ask the child to draw something, and from the drawing you can find out that what are the thinkings going on in the child mind. Or you give a pillow and say that, okay, this is daddy, do you want to hit daddy? And the child says no. But you say, this is the grandma, do you want to hit? And the child starts hitting the pillow. So these are the different techniques, different tools by which you can make out that what is the psyche of that person and try to cure that person. Any sort of say for example, you elite something to the patient, or something which the patient is saying, you very rudely say that no, this is not possible, or you made rude corrections, or you made rude remarks for the patient. This is no, not at all. This is not going to help you in bringing out the mental symptoms. So these are the certain things which I have written, that these are the not to be performed. Otherwise, the real picture, the mental picture will not come out. Now, if you follow all this regime, all this discipline, and if you follow the guidelines which are written in Organon itself, you don't have to follow anything else. You can bring out the subjective and the mental symptoms from your patient, and in doing so you will fulfill your mission to restore the sick to health, to cure. And the cure will be the ideal one, that is rapid, gentle, permanent restoration of health, removal and annihilation of the disease in its whole extent, in the most shortest, most harmless, most reliable way, based upon the easily comprehensible principle. So the mission of a homeopath will be followed or will be fulfilled only if you follow the teachings of Organon, written by Dr. Hahnemann himself. Okay, so this is it. Thank you.
Thank you so much, ma'am.
Thank you.
Thank you so much, ma'am. I would like to request everyone to mention your queries if you want to ask something from Dr. Heena. So we'll clear up the doubts. Ma'am, there was a question before I want to tell from Dr. Sharmishtha Bhattacharya.
Yes.
She is asking how subjective and mental symptoms will be taken in case of disabled patient who cannot speak. Yeah, who is not able to speak. How can you take the
Yes,
subjective and
that
mental?
is a very difficult the part of case taking. That if the patient is not able to speak, then to take the mental symptoms becomes very difficult. For that, we have got only two things: that either by the signs or by the expressions of the patient, and secondly by the attendant of the patient. If the attendant of the patient is there, who is looking after the patient, one who is staying with the patient day in day out, that person can tell you the best about uh, the mental state of that patient. So you can take the help of the attendant. It can be a mother if it is a young child or something, or it can be a spouse, or it can be anyone, any attendant of the patient, or it only by the expressions of the patients. By you talk to the patient, you are not able to talk, but at least by the expressions or the sign language.
There is one more query, ma'am, from Dr. Hidat Mehta. We have Dr. Hidat Mehta also here.
Yes, okay.
So how can we proceed if the patient is schizophrenic?
Schizophrenic, see, it is very interesting, and I have come across many schizophrenic patients also. The schizophrenic patients have they have different phases in their course of disease. Sometimes I've seen the same patient becoming suicidal and the same patient become homicidal. So it is a long term, it's a long treatment which has to be carried on. Or say, I've seen the schizophrenic patient that they become very timid, very mild, and they become very aggressive also. Now, what I have done particularly, again, I have followed Organon. That in Organon, Hahnemann has written that when this is the case, then what you do is that when the patient is very aggressive, at that time you give the short acting acute medicines. Like if there is a mania, then you may think about belladonna, or if there is a lascivious mania, you may think about the hyoscyamus. So you give short acting medicines after the attacks, or after the intensity of the attack has reduced, and then the patient has become quiet. At that time you think about a constitutional medicine or a similimum, taking the entire phase of the disease, and not only that, the past history of the patient also. I have seen patients where the schizophrenia is started, means there is a family dispute. Like say I had one patient who was a professor in a medical college, and he had an extramarital affair with one of the lady doctors who was working with him. But at the house his wife was not educated, not means she had not even finished her schooling, and so the intellectual did not match. And so he started having that intellectually he was compatible with this lady doctor, and this created so much of tension in the house. And especially the elder brother of that professor, he used to intervene, and he used to be very rude with this person. And it was a very beautiful case. Initially he started with psoriasis. The psoriasis was suppressed with allopathic medicine, because he was a medical professor in a medical college. So with allopathy the psoriasis was repeatedly suppressed for so many years, and then this man became schizophrenic. And during his attacks of schizophrenia, what was happening, that he used to become so violent that he was kept in the same hospital where he was working, and he used to be chained. But when he got violent, if he saw a man whose structure, whose dressing was like the elder brother, if some person like that, or if the elder brother came to visit, initially it started when the elder brother came to visit, he used to get violent, and he used to remain violent for days together. And then later on it happened that they stopped the brother coming. Even in Organon it is written that the things which aggravate the condition of the person, see that you avoid those things. So that person, the man, the elder brother, was not allowed to visit this man. But then if he saw a ward boy or someone looking, having the same height and structure, he used to get aggravation by this also. So this is in schizophrenia, that we have to be very tactful In between, you can start using the totality of symptoms must be of the past history and the present. But if at all, whenever there are acute attacks, as I said, that the patient can become acutely suicidal, can become acutely homicidal, very aggressive, very timid, crying for days together. So you need to change. You need to give acute short acting medicines just to bring down the intensity of the symptoms. In Organon, there is one more hint also, that when these manias come, you give a short acting medicine. When the manias recede, then at that time you use antisoric medicine just to see that these manias are not repeated again and again.
Thank you, ma'am. We have more questions. Somebody is saying to repeat that technique of pillow, father and grandmother.
Okay, that is
Got it.
I was using it, that you keep a pillow, and if the child is very cranky and not obeying this, like in front of other people, he's not behaving properly. So then what we used to do is that, okay, this is your father. Do you like your father? So if the child says the pillow is your father, or the pillow is your grandma, or the pillow is your mother, or the pillow is your elder brother, and I have seen that if the child has got hatred towards the say elder brother, then if this is your elder brother, what will you do to this elder brother? Then he may start hitting the pillow. Now this gives you a mental symptom that there is an internal hatred, and then you may ask the child that why you are hitting this, why you are hitting the elder brother, and he may come out with that he is not giving me this, he is doing this, he is bullying me, or he is hitting me, or it can be abuse also again. So this is how to bring out the, and it is a form of ventilation also, that whatever the grievance or whatever hatred he has, that will be ventilated also. So that was one technique which we had adopted, especially in a form of psychotherapy.
Thank you so much, ma'am. There is one more question, that is how the obvious cause will be elicited, from Dr. Vibhu Prasad Panda.
Panda, yes. Panda sir is a teacher of Organon. He knows better.
Oh, great.
Still,
Oh, great.
still he is a. See, obvious cause is that when the patient is coming to you, and as I told you, the disposition, that becomes the obvious cause of the patient. That whatever is the disposition, right from the patient entering and sitting in front of you, starting talking to you, and when you are doing the entire case taking, if you are keeping an eye on the patient, the disposition of the patient will be known, and that will become the obvious cause. And this is how you elicit the disposition. See, Hahnemann has also written that disposition plays a very important role. Like, all the symptoms are of aconite, but the patient is sitting very calm, quiet in front of you. The patient is not at all restless. Then never ever give aconite to that patient. In the same way, he has given an example that the patient who is joyful, very gay, and the patient who is taking, like, he is very obstinate, he is very obstinate, he whatever he decides is final. And then there are other symptoms which are all of pulsatilla. The patient is thirstless, or while telling the symptoms, the patient has wept. I always tell the students that everyone who weeps will not get pulsatilla, because you come to know that this lady is working in a institute where there are 500 people working under her, and while telling something emotional about herself, she has wept. But she is the one who is looking after 500 people, who is the boss of 500 people, means she is going to be decisive. And here, when a person is decisive, you never ever think about pulsatilla, because pulsatilla has got that yielding disposition, indecisiveness, yielding what others decide they will do. So these are the things which are obvious, the disposition of the person, which plays a very predominant role in deciding your medicines, which is written in Organon also.
Thank you, ma'am. Thank you. Thank you. I think there are more questions, like
Do we have time? That is why I finished my presentation also.
Yeah, one more question is there for the
Yes,
COVID-19 situation. How can we
yes.
prescribe medicine without case taking as it's the acute emergency period? So I would like to ask you if you want to answer this question on this platform, or you want to answer this in person from
No,
Dr.
see,
Shailesh.
I was just now, just in this afternoon, I was seeing a video where COVID-19 patients, as it is, we are not allowed to treat them privately. But I was seeing a video on the Hamai group that somebody had taken the history, and on that history, the medicine was prescribed. But I don't know that whether it is possible to do it, because as soon as a person is found to be COVID positive, then the person has to inform, has to notify, and whether that person can be given medicines or not, that is a big question mark, that whether case taking is possible, and whether, because we have to take the permission from the state government. So that is the thing. But of course, yes, if we can take a history and if we can prescribe, that can be done. That can be done, and we can follow again the principles of genus epidemicus, which are written in Organon.
Yes, ma'am. Thank
Hmm.
you. There's one more last question, I think, from Dr. Jerin Paul. This vital force deranged because of miasms, or after derangement of vital force, the miasm sets in?
The miasms are nothing but the influences, the noxious influences of which can derange the vital force. So it is a effect which is going on simultaneously. It is not whether the vital force is deranged first and then the miasm comes. The miasm produces a noxious influences on the vital force, and that is how the vital force is disturbed on a dynamic plane, as I told you previous also, that not on a material plane. There is no exchange of material. It is on an immaterial plane, that the quality of one is altered by the qualities of the other without any material exchange. So it is entirely on a dynamic plane which is occurring. It is the influences, the miasms are the influences which can derange the vital force.
Thank you, ma'am. Thank you. I think nobody is having more queries. We have to take from Dr. Deepthi. We have a question. We have to take mental symptoms. I don't know if it's a question or an answer. We have to take mental symptoms of disease state or patient in normal state as a person when he is not suffering from mental disease. Also, the desires and aversion are to be taken for disease state or in general healthy state.
No, 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 no. It's like, as I told you, that the change in the personality which has occurred are the most individualizing ones. The changes which have taken place after the sickness, those are the change in the disposition of the person which has taken place are the most individualizing one.
Thank you, ma'am. I've also shared your email ID with the participants in the chat so
Yes,
that they can ask you the queries.
sure,
It's
sure.
Heena Rawal 28@yahoo.co.in. Am
Yes,
I
yes.
right, ma'am?
Yes,
Yeah. If
right,
anybody
right.
is having any doubt, they can ask Dr. Heena personally on mail. One more question is there from Dr. Adrian. He's saying which is different. What is the difference between miasma and agent's pathogen? Then
Miasma and
agent's pathogen. I think some spelling issue. He's asking miasm and pathogen difference. Pathogenetic agents, I think.
pathogenetic agents means the bacteria and the viruses. What exactly he means
Yeah.
by the pathogens, by the bacteria pecans,
Uh,
that is the
I,
material causes of diseases.
yes, ma'am. That are the material cause, and miasm is the germ actually. Dr. Adrian, I would request you to please type your question again so that we can understand
For that,
better, or you
if
can
I want to
personally contact
explain
Dr.
this,
Hina.
yeah, if I want to explain this, I need to explain the entire theory of chronic disease. That how from the materialistic aspect, because how Hahnemann had described the cholera vibrio when he wrote the chronic diseases, and for the Asiatic cholera, which was pandemic in Asia, and then from that pathogen, that is the bacterias, how he got converted to the theory of miasms. So for this I need to take 1 hour more, that is the entire theory of chronic disease is to be explained. They are different miasms in if he means bacteria and viruses, or he can
Yeah, thank
email
you.
me.
Yeah.
Yeah,
He can email you, otherwise he wants, because it's a big, matlab, it
yeah,
needs
it's
to
a bit.
explanation.
Yeah,
Yeah, it's
it needs
another
lots of
another webinar.
explanation. Yeah, another
It's another
webinar.
webinar.
Yes, yes, yes.
Yeah, yeah. So I hope we'll get more knowledge in upcoming webinars from you as well, ma'am. Uh, so any more doubts? I think nobody else have more doubts. So so before we end up, I would like to thank you, ma'am. Thank you, Dr. Heena Rawal. I'm sure that's been a wonderful session on mental and subjective symptoms, and everybody has well understood that how to elicit mental and subjective symptoms and individualize the patient for making the totality. So on behalf of 360 and BGen Group, I would like to thank you, ma'am, for giving 360 your valuable time and guiding the homeopathic fraternity through your with your knowledge. So my heartful thanks also goes to all the
Thank
learners
you.
who
Yes,
have been.
thank you, Ashika. Thank you so much, and thank you, Dr. Rajesh, also, who is in the background helping us. So thanks
Yeah,
both of you, and of course, Dr. Manish.
yes,
Thank
ma'am.
you very much.
So also I would like to thank all the learners who have been with us today. Before I sign off today, a very important vote of thanks must go out to people who are behind Team Homeopathy 360. Yes, it's Team Homeopathy 360 that works day in and out to bring you information related to homeopathy and make you updated. Plus Dr. Rajesh and Mr. Manish Jain, who have been with us as a back-end support system. And thank you everyone. Stay connected with us, keep participating. Likewise, we would also try to share our recorded version on our YouTube channel of Homeopathy 360 soon. We would love to hear from you. For any queries, you can mail us to webinar@homeopathy360.com. Thank you for taking out time and being here today.